G'day, my name's Pip Southwell. I am a lecturer in rural health at Three Rivers University, Department of Rural Health at Charles Sturt University. I am proud to live, work and study on Wiradjuri land, and I like to pay my respect to elders past, present and emerging, and extend that respect to all Indigenous colleagues meeting here today. I am a medical scientist. I am a girl, and that makes me in a pretty great position to talk about how young people, particularly young women, can pursue a career in STEM. I've done it whilst carrying a really strong passion for health, because these two things aren't separate. I work to support young people to make better decisions about their career choices by making informed decisions about what kind of course they'd like to study, and making sure that that decision is based on their interests, their strengths and their passion, where they'd like to see their career go. Last year I was on a panel and a young man asked to the panel, how do I get a job in tech? And the panelist with the microphone responded, well, you get this qualification from my institution, and then you get this qualification from my institution, and then you get this qualification from my institution, and then you can go get a job in tech. And then they moved on to the next question, and I left that event thinking, I didn't do my job today. I didn't do well today, because what I didn't do is advocate for that young man, to remind him that tech is not separate from the rest of the world. That tech is embedded in everything we do in the world. That science and technology and engineering and maths underpins so much of who we are as a society, that a job in tech will never just be listed as technologist. It's rare to see a job that is scientist or mathematician. Rather, we take that way of thinking. We take the paradigm of STEM, and we don't spell it as STEAM with an A for arts or agriculture, or with two M's for medicine, or with STEM with an H for health. Maybe I'll take that one. But we actually take the lens of STEM and flip it, and we look at our disciplines through the lens or the paradigm of STEM, because health and STEM are not separate entities. They're actually inherently intertwined. We can also look at agriculture through the lens of STEM. We can look at education, economics, politics, art, history. We can look at all of these disciplines, the law, through the lens of STEM. And it's the way that STEM comes alive when we take it into the discipline and we take it into the real world. My job involves me going into lots of schools, doing immersive health activities in those schools. And so while we have children's hands on CPR mannequins, or doing a concussion assessment, or dissecting a long bone, we're asking, who does this in the real world? And that is my challenge with this presentation, to give you an insight into who does this in the real world. And to do that, I have to talk about my own journey as somebody who has pursued a career in STEM, but also a career in health. I was interested in health from the get-go. Even as a very little girl, growing up in country towns, my parents are teachers. We moved around a lot, but I was always interested in health, if a 4-year-old can be interested in health. And people told me lots of things. People told me that as a very smart little girl, I was too smart to be a nurse, which I think is just a total misconception of the challenges that it is to be a registered nurse now. If you want a discipline of innovation, you want to be in nursing. I was told that because I was not into sport, they were right, I'm not into sport, that I shouldn't be a physiotherapist because physios deal with sport. And I went on to a career working in respiratory science, respiratory medicine, working hand in hand with physiotherapists that were equally dispassionate about sport as I was. Physiotherapy isn't just contained to sport. So I was told, even when I came out and said for myself, I think I want to be an optometrist. You should be an ophthalmologist. You should be a doctor, because that was better. I was 8 This was all done and dusted by the time I was 8, and I stayed on that medicine trajectory until I was 18, and somebody, a friend's mother, pulled me aside and said, "Why medicine, Pip?" And I said, "Because that's what people expect me to do." She said, "But what do you love?" I was like, "Well, I really like science, and I really like health, and I really like people." "So why aren't you becoming a scientist?" she asked. It was such a simple question. She was a scientist. She had pursued a career in science. And I am eternally grateful for that woman who actually stopped, who challenged my assumptions, my parents' assumptions, and said, "What do you love? And how do we turn that into a career?" Rather than pushing you into a career that isn't necessarily fully aligned to who you are as a person. And I've had a wonderful career as a scientist, and I don't regret making that change, not for a moment. So what I want to do is be able to equip people to be that person that says, "Stop. What do you love? How do we make this come alive? How do we take that passion for STEM and turn it into a career? What do you love to do?" And I'm going to run you through some case studies of how I do this when I'm working with young people, and so some of the different allied health professions that aren't necessarily the top of the list when we say a career in STEM, a career in health. The first one is actually pharmacy. Pharmacy is a relatively obvious choice, and it's a really strong chemistry base. It also uses the math skills very strongly. What people probably don't understand about pharmacists is how much interaction they have with their patients and the level of counselling that they provide to patients, particularly in the community setting. So pharmacy comes from this really rich science base, but a lot of their work is translational in taking that science and communicating that science to people in the community to understand their medications predominantly, but also to understand their health better. I think the other aspect of pharmacy, when I have students and I ask them what do they love to do for fun, because sometimes they get so overwhelmed by, "Oh, I've got to make decisions because I'm 17 and I've got to make all these big life decisions right now," and they can't. And I say, "What do you do for fun?" And as soon as they say they bake, I think pharmacy. And I think pharmacy because actually there is a real method in that construction. So whenever, most of us haven't had the joy of ever seeing a pharmacist compound a medication. It is an art, but it's a lot like cooking. And when you have somebody who's naturally curious in that way, it is a way that they can actually take those skills and apply it into health. The other thing to flag there with something like pharmacy, and actually all health disciplines, the health industry exists predominantly because something's going wrong. And as health professionals, our job is to troubleshoot. Our job is to have ideas of how to fix problems. If that's not STEM, I don't know what is. So with pharmacy, actually, there's a sense of creativity that we really want to foster in our students, so that when they have this highly dynamic work environment and people are constantly throwing curveballs at them, that they are enjoying the challenge and the flexibility that comes in that kind of environment. So highly precise work, but highly creative work. And that's something that's probably misrepresented about pharmacists a lot. If we shift out of that kind of chemistry space more into the physics world, radiography becomes the obvious choice. So I had a beautiful young woman come up to me at a careers expo with her mum a few months ago and say, "I'm thinking about doing nursing." I was like, "Awesome." And I said, "Why nursing?" My question. And she said, "Oh, I really like the idea of being in an emergency department. And I really like the idea of working in maternity. And I really love tech." And I thought to myself, well, yes, there's nursing. Nursing can do all of that. That's the joy of nursing. But at the same time, I want you to have a think about medical radiation science, because what we have in radiography is the capacity to work across all of those disciplines. And I looked at her mum's face, and her mum's face was like, we knew there was something. We knew there was something that would harness all this enthusiasm, but we just weren't sure what it is. This sounds amazing. And what we really want to share the word about radiography is how diverse that work scope is. So students will actually train, they can train across multiple disciplines of radiography. When we think radiography, we traditionally think X-ray. You're absolutely correct. But we can also move into the space of nuclear technology, moving into testing protocols like MRI and CT, so computerized tomography. Radiographies are literally the interface of tech and the patient. It's a beautiful space to work for somebody who's passionate about working with equipment. I'll also flag as a medical scientist, along with the radiographies, we are renowned for tweaking our equipment. So you have somebody who's interested in things like robotics, building, circuitry, things like that. This is what we do, because as scientists, we can't help ourselves. The other aspect of radiography that doesn't really get much airtime is actually the times that radiography can step over into out of diagnostic medicine and into interventional medicine. And that's where we start to get into the spaces of working in things like cardiac catheterization labs, but also radiation therapy. So radiation therapy, if somebody has cancer and they're getting chemo and radiation, it's a scientist that is actually administering the radiation. They work with the clinicians, with the nursing team, with the patient, but the person you'll see is actually a scientist. So it's about harnessing that enthusiasm at predominantly the physics level, but their anatomy will be very, very strong by the time they finish. So I just really want to challenge these ideas about what we think a radiographer actually does and the kind of students that may actually find this really fulfilling work. Because it is that balance of the physics, the technology, but also the patient interface. The last one is the example I use when I actually want to merge sport and exercise with health. Because all of these things, sport, STEM and health, can come together in a couple of core disciplines. Not the discipline you're thinking about though. You're probably thinking physio at this point, but I'm going to chuck podiatry at you, of all things. Now, I'm not going to lie. If you're not into feet, this is probably not for you. But podiatry is so much more than working with people's feet. It's actually where pharmacists are specialists in medication, podiatrists are specialists in the lower body. So they work with people to improve their mobility, their gait, how they walk, as well as the health of their lower legs, including their feet. What people probably don't understand about podiatry is how much biomechanic work happens in that space and how much technology is involved in doing those assessments. The other thing about podiatry is a lot of podiatrists now in Australia have prescribing rights. So they're going to work in the space of pharmacology to understand the medications that are needed by their patients, and they can actually prescribe. And then they go visit the pharmacist. Why I use podiatry as the link between sport and health is because, frankly, when people come and say, oh, I want to be a sports physio, you're like, great. Generally, the example they use is I'm from Central West New South Wales. So they'll say either they want to be the physio for the South Sydney Rabbitohs or the Wallabies. And I will just gently recommend that South Sydney and Wallabies have a crew of physios, but maybe if you want to get into elite sport, something like podiatry might be a really unique way of bringing that passion for sport. Because what we can do in disciplines like podiatry, exercise physiology, and sports and exercise science is harness the science, the biomechanics, and actually promote health and well-being through exercise and push that into the space where they can be working with elite athletes as well. Not everybody will work with elite athletes, but what you will get with something like podiatry is a really beautiful qualification to be a really integral member of the health community. I guess at the heart of this is to push the shift away from health being doctors, nurses, and physios. Now, doctors, nurses, and physios are really, really important, and I don't want to underestimate their value in the community of practice. The other one that's cropping up for a lot of young people now is paramedicine. It's very topical at the moment. But when a an 8-year-old from Coonabarabra says they want to be a health professional, I want them to be able to access the resources that turns this conversation of doctor, nurse, physio into this conversation about what do you love and how do we turn what you love and what you are good at into a career. Because if I'd had that conversation at 8, imagine what would have happened by 18. For me, I'm really grateful for that woman that stepped in. She was brave. She's a fairly fearless sort. But she actually took us as a family on a journey. She worked with my parents, she worked with me, and she really disrupted the trajectory. And I am really very grateful for that. Because I want to be able to have conversations now with young people to say, you love art? We're going to talk about dentistry and oral health therapy. You want to transform people's lives? We're going to talk about the power of an occupational therapist. You want to take care of people? Let's talk about who the midwife and the pharmacist and the GP are to their community. We want to have better conversations. And it's all well and good you say, great, Pip, you know your industry back to front. That's really useful for you. How do I go about doing that? How do I support students to make their career in STEM come alive? So I want to provide some practical resources for you as well. So I work for Three Rivers UDRH. We're one of multiple university departments of rural health dotted around the country. We are all funded by the Commonwealth Department of Health to increase rural health workforce. I've got to add the disclaimer that part of what's been fabulous about my career in health and science has been that it's happened in a rural area. We have a suite of resources available to you, no firewall. Go in and have a hunt around on our student tab on our website, where you'll be able to look at a nice succinct list of health careers and courses, how to get into those courses. We have some beautiful supports, particularly for Indigenous students. We have scholarships and grants available. And in the student resources tab, I'll just alert you that we have our online careers explorer. We've built a fictional village, the village of Hardy, because they're hardy, where you get to go in through a number of case studies, meet a patient and go through the patient journey, meeting the health professionals that interact with them. We've taken the education approach to actually make people more aware about what the professions do in the real world. So students can actually go choose their own adventure. We're using Smart Sparrow technology to make that a resource available to every student, to have better conversations about what a career in rural health would look like. The other thing I really want to flag as a takeaway is in the Indigenous student tab, we have our Indigenous Pathways into Health handbook. This is a handbook that's been developed over time to be a culturally sensitive response to young Indigenous people considering a career in health, to talk about what it is to go to uni, to talk about the supports that are available for Indigenous students at university, but also to break down the disciplines. And this is one aspect that's actually very appropriate for all students that are considering a career in health. So we speak about our 16 disciplines of health in this booklet. It's available to you as a PDF, but it actually breaks down what the profession is, the courses that are available to them, and actually speaks to the profession a little bit. And we've got frequently asked questions for each of the professions. So what kind of nurse could you be? Where for an exercise scientist, we'll talk about the core career outcomes and where you go next. So the other aspect of this resource is down the bottom. For students coming through year 9 and 10, we can actually recommend some of the subjects they might consider for their HSC to pursue this line of investigation. So this is available to you on our website through the Indigenous Students tab, and you can go and have a look anytime, and please share that with your students. Thank you. Thank you for taking the time to invest in your students and your own professional development by attending this symposium. I hope I've been able to share a little bit of my enthusiasm for my career in STEM and my career in health, and to see that I was helped. I was helped to see myself better. Somebody took the time to say, I see you. I see your excitement. I see your passion. Now, how do we harness that and put that on a really clear trajectory to start a career that you will love? And I have loved. So please take care of yourself. Please wash your hands, and Thank you for your time.